Okay, shall we begin? Can everyone hear me? Can I hear you?
I can hear you.
Awesome. Hello, everyone. My name is Rusty May Squires. I'm the peer counselor here at the agency, and I wanted to welcome you to our 14th annual first virtual community forum. We usually have this in the month of May for Mental Health Month, but due to COVID wreaking havoc in our world, we had to set it for Zoom. Please accept our apologies for any tech issues we may encounter. Heather and her team have worked very hard to make this work. There's a chat box to enter any questions you may have, but you will have an opportunity later in the forum for open discussion. Our agenda for today is to provide information on updates on our agency, our program profiles, peer supports, COVID-19, and other presentations we hope you will find useful and helpful. So for those of you who are familiar with using Zoom, Heather's going to do a tech etiquette presentation to help you understand the buttons and the use of Zoom. Heather, off to you.
Awesome, thank you, Rusty. Let me get a different screen to share. So it's hard to believe, most of us have been using Zoom now for, gosh, I guess 7 months. I feel like that's the only way we get to see people these days. But I just wanted to make sure everyone was comfortable with the platform. So I'm gonna go ahead and share a few tips and tricks. So let me know when, sorry, I'm trying to let people in and share my screen at the same time. So if you guys can let me know if you can see this picture right here. This is a screen, a test screen for Carelogic, or sorry, for Zoom. So if you can see at the bottom here, you will see a microphone. That is your mute and your unmute button. And so what that'll allow you to do is participate in the conversation. We do ask that you stay muted until you are called upon, or we ask for you to partake in the discussion. It's nice to not have distractions if we can limit it. So you are not required to be on video by any means. Like Rusty said, this is typically a face-to-face situation. So we would love to see who is here with us today, but if you don't feel comfortable, that's totally fine. As you can see, I don't have my video on. If you would like to participate, you might have a question or you just want to share something. If you press the participants button, you will then get a screen that looks like this, and you will see your name, and you would be able to raise your little blue hand. So if you want to participate, that's a great way to get our attention. We may not call on you right away, but we are monitoring it, and we'll make sure that you're included. If you'd like to drop us a chat, you can press that little speak button or the speech bubble, and that will deploy this screen, and then you can just type your questions right in there. So that's a great way to participate as well. And then finally, if you'd like to rename yourself, if you'd like to add your pronouns or you wanted to stay anonymous, you can click on your name, and then that'll give you the option to go ahead and change that. Okay, so then I'm going to go over a few more tips. Just so, again, to make sure we're all on the same page. Again, we'd love to see your face. If you feel comfortable using your video, we'd love to just engage with you that way. If you are using your phone or your computer, it's great if you have headphones. It just kind of eliminates that background noise, and then also allows us to see you and to hear you more clear without feedback. If you can, again, keep yourself muted unless you're speaking. That just allows us to focus on the person who has the floor. Again, you can change your name. Also, if you're calling in with your phone number, if you could also change it to your name so we can call on you and engage you with your name instead of your phone number. Again, if you have questions, go ahead and put those in the chat box. We have presentations throughout the next 2 hours, so if we don't get to you right away, don't worry, we didn't forget about you. We'll get to you. We're monitoring that. Also, if you have tech questions, tech problems, you forgot all these things that I told you about the buttons, go ahead and throw me a chat in the chat box. I'll be reading it throughout the day and try to help you as I can. Probably, I'll bet you at least one of us will lose connection during this presentation. No worries, get back on. I'm also monitoring the waiting room and can let you in. And then finally, please participate. We'd love to hear your feedback. The whole purpose of this forum is so we can connect with our community and see how we can serve you better. So please feel free, if you don't feel comfortable talking right now, that's okay. Put it in the chat box, send us an email, let your voice be heard. So we're excited to have you, and thanks so much. Back to you, Rusty.
Okay, thank you, Heather. So what is the purpose of the community forum? So let me start by saying Pend Oreille County Counseling Services provides treatment, education, and support for mental health and substance use disorders. Education, promoting individual choice, community, and belonging for wellness and quality of life. We care about our consumers and appreciate their contributions toward our efforts to improve our services. Our mission statement is making a difference with compassion, integrity, and hope, and we live by that statement. Like Heather said, this forum also gives our community an opportunity to provide feedback and input about our services and how we can improve what we do, and hear about the new changes, updates, and learn about mental health and substance use awareness. We want to hear from you. You are important to us. So we also want to make this forum fun as well. So I'm handing this back to Heather for our first activity.
Awesome. Thanks, Rusty. So you'll all be entered into a random drawing for a very cool t-shirt and other prizes just for attending today. So thank you so much. But we'd like to know who's here. Again, this is going to remain anonymous. So we're just trying to get an understanding of the demographics. So if you wouldn't mind just putting in here how you're joining us today, if you're part of an organization, you're here as a client, you're a community member, maybe you're with the school or you're a family member, if you can just go ahead and share with us. I have a few more people I'm waiting to respond. Give it a few more seconds. Awesome. All right, so it looks like some people from the community, we have some agency and organization folks, so a good mix of people. Thank you guys for participating.
Okay, so next we have our program profiles, and Carrie's up next to talk about the prevention coalitions.
Hi, everybody. This is Carrie McKinley, and I am the Prevention Program Manager here at Counseling Services. I've been with the agency for 8 years, and we have 3 community prevention coalitions in our county. We have the Newport Youth Task Force, the Panther Country Coalition in Cusick, and the Selkirk Wellness Coalition. All of these coalitions are supported by the Healthcare Authority and their Community Prevention and Wellness Initiative. The Panther Country Coalition began in 2013, and the Newport CPWI Coalition and Selkirk began in 2018, November of 2018. So what we do is we use local data to drive our strategies for youth substance prevention, substance use prevention, and also mental health promotion. So some of the programs that we have right now in our schools are Too Good for Drugs. These are evidence-based programs, by the way. Life skills training, Second Step, sport prevention and wellness, and the newest one is Mentor Washington that will be kicking off this year. We also have some parenting programs that we implement. One is Guiding Good Choices, and the other is Strengthening Families. We do a lot of education and awareness events. And the great thing about community coalitions is that they bring different members of the community together, like healthcare, school administration, parents, youth, law enforcement, local government, tribal government. We just all come together and come up with strategies that work best for the community, because we know that the answers to our problems are always in the community. So it's a great model and it's really effective. I wanted to introduce our coalition coordinators really quick. I think we have all 3 of them on the line. We have Donna Kelly from the Cusick community. We have Beverly Sarles from the Newport community, and Angie Rowley from the Selkirk Community Coalition. So real quickly, if each of you could just let us know briefly what the last program or activity that your coalition implemented, just super quick. So let's start with Beverly, and then Donna, and then Angie.
Thank you, Carrie. So right now, our coalition actually is doing our community surveys. So we have the ability for people to do this online through a link, and we have paper copies. So we're hoping to get the opinions, perspectives from our community members so that we know how to implement those strategies that you were talking about to help us with our efforts in prevention.
Awesome. Okay, Donna, Kelly, do you want to introduce yourself and let us know what's going on in the POCCS community?
I am Donna Kelly, and I am the CPWI coordinator up for the POCCS School District. I also work with Marty Meineke with the Kalispell Tribe. The latest program that we have implemented is sport. Sport is for youth. It is a health emphasis substance use reduction program that is one-on-one with our youth in the community. We are also in the process of getting out our community surveys, and once again, always looking to start parenting programs. And I want to give a shout out to Sarah McNew and those that have my community partners that joined us this afternoon.
Thank you, Donna. Angie.
Hi, everyone. Hope my connection at Selkirk High School. And the last program we did was Guiding Good Choices. It was a really cool program. We had a lot of parents involved. It's the age where kids are entering middle school. Those are the parents we're focusing on. And we just had a wonderful time and great friendships were formed. And yeah, it was a great program.
Thank you, Angie. So community members, please let us know if you'd like to get on our email list and be invited to our meetings. We would love to have you. The more, the better. That's it for us. Thank you.
Thank you, Carrie. Jennifer's next. She's going to talk to us about SUD and mental health outpatient.
Sorry, Jen, before you jump in, it looks like we have a question. Annabelle?
I'm sorry. It just occurred to me that this was a great opportunity to do a shout out. So I think some folks know, but not everybody. Every year, the state has some recognition for people and organizations who do excellent work in prevention. And our very own Carrie McKinley is going to be receiving an Excellence in Prevention award this year from the state. And I just think that's something as a community we should be very proud of.
Good job, Carrie.
Thank you, Annabelle. It is an honor for sure. I'm definitely thrilled and humbled by that. So thank you.
Hey, hi everybody. I'm Jennifer. I'm the clinical director over outpatient services, which includes mental health and substance use services. So we provide both of those on an outpatient level. Our substance use services include assessment, outpatient treatment, and intensive outpatient treatment, depending on the level that's recommended by the assessment. And then we do referrals to inpatient services within Spokane or the surrounding community, as we don't have an inpatient facility in our county. Our mental health services serve all age ranges, from youth to adults, providing individual counseling, school-based counseling, family services to some degree, and some case management and med management as well with our contracted psychiatrists. Due to COVID, we have moved most of our services remotely, doing those by phone or by Zoom. Fortunately, we are still able to provide services in those ways so that we haven't had an interruption in services this year. But it definitely is an adjustment doing them virtually in that way. But we're still happy to be serving folks and providing needs within the community. So I'm happy to answer any questions if anyone has any about our outpatient services. And one of our WISE folks is going to speak to our wraparound services for youth. That's a little bit different than traditional outpatient.
Thank you, Jennifer.
Hello, I'm Brittany. I'm the WISE Care Coordinator. To start out with, WISE stands for Wraparound with Intensive Services. It is a completely voluntary service with a team approach to meet a youth and family's needs. When I talk about a team, that consists of a mental health counselor, a care coordinator, a peer partner, and a family partner. What makes WISE different is that it's a 24/7 based program. So say you work till 6 o'clock, we meet whenever you need. So that's always nice. It is very intensive. So whatever parties you're involved with, say the school, detention, anything like that, we all like to come together and wrap around you and make sure that your family and you are supported. We also offer crisis support services. And prior to COVID, we were community-based, so we can meet in the house, at the school, wherever. But due to COVID, kind of have that limited. So we're really hopeful that in the future, that feature will return. If you have any further questions or want to know about our program or want to make a referral, you can always just call our office and ask for me, the WISE Care Coordinator, and I'm happy to answer any questions or take any referrals. Off to crisis services.
Thank you, Brittany.
So my name is Candy Alley. I'm the Crisis Services Manager, and we operate 24 hours a day. We have walk-in services between 8 o'clock and 4 o'clock here at the facility, so you could walk into our building any time of the day and be seen. We also provide services over the phone, and we do use technology sometimes if we're doing an involuntary assessment for treatment. So that means that we have a relationship with the hospital where we can do telehealth over there to determine whether or not somebody needs additional. Hi. And another thing that we do is we try to do immediate short-term stabilization with individuals. We get a lot of phone calls from the community. We get phone calls from the sheriff's department. We get phone calls from the hospital when they've identified somebody who's potentially in crisis or is already in a full-fledged episode of crisis. And a lot of the individuals that we respond to are having suicidal thoughts, or they're acting out and have a plan for suicide. Other folks are severely mentally ill, and they can be decompensating to the point where they're no longer functioning at a safe level. And so we have to assess and find treatment that's appropriate for those individuals. That's kind of what we do here. And we're called DCRs, so we're designated crisis responders. We have a lengthy set of training that they put us through so that we understand the laws and our limitations in the community. And we try to really be careful of not stepping over boundaries or breaking any kinds of individual rights.
Thank you, Brittany. So if you have any questions, you can ask in the chat box or wait for the open discussion. So that brings us to our first or another presentation. We're going to do a presentation on Becca and I on peer specialists.
I'm gearing you up, Rusty. Any questions from the crowd? That was a lot of information. No? Okay. All right, then I'm going to fire you off.
All righty then.
Oh, that's, what do you see? You see it?
Not the whole picture, just the PowerPoints.
Yeah.
There we go.
You good?
I'm good. Okay, so I'm doing a presentation on peer support specialist, or AKA peer counselor. Oops. It went back to the slides.
Okay, hold on one second. Oh, please. Don't know why it's acting wonky. It's tired. Who wants a break? Okay, wait, here we are. Can you see it now?
I see you.
Oh, you see me? No, not really. Not really in real life, right? Oh, God. Okay. No, still not. Talk amongst yourselves. I have to reopen it because it. Go ahead, Anna.
While you're loading that up, I guess I'll just kind of put Candy on the spot. What are some of the rights that we try to protect when we're balancing as a DCR? That importance of the civil rights versus clinical decisions that have to be made.
One of the things that's really important is that we don't detain people unless they are at imminent risk to self or others. So just because somebody is behaving differently or bizarrely, or they don't fall into the norms of our communities, does not mean that we can just remove them from our community and send them to inpatient care. We really have to have valid reasons behind that in order to, against their will, put them into an inpatient facility. There are a lot of things that happen with an individual in terms of their rights. Number one, they lose their gun rights for 6 months if they're detained. That's a big deal for a lot of people in our communities, our local communities here, because there are a lot of gun rights advocates here. So that's a big deal to them. And then when they are detained, they're detained for 72 hours. They have the right to go to court, to get an attorney. We have to be respectful when we read those rights to people. If they tell us, well, I don't want to participate because I have the right to remain silent, then we can no longer interact with that individual. But it does not mean that we can't continue the investigation, because that person may not be competent enough to recognize that they've deteriorated to a state that now their nutrition is at risk, their behaviors are such that they're walking in traffic, or they're doing things that are just going to get them hurt, or something may happen to somebody else. So we really have to keep in mind, where is this person at right now, and where is that threshold that that means that we have to take that initiative to get them into the hospital. And sometimes that can be tricky. And other times it's pretty cut and dry. We know that that person is not in a good place and they need to go to the hospital. And the best thing that we can do is detain that individual. And oftentimes people come back into services and they're thankful that we did what we did, because they didn't realize where they were at the time that they were going through this type of crisis.
Thanks, Candy. So it's not like the old days where, what is it, one flew over the cuckoo nest, where we can just randomly walk the streets and say, we're taking your rights away and you're going.
Exactly. It takes a lot of investigating too. It's not always best practice to stop at the individual who's in crisis, but it's good practice to find out more about that person. We have the ability to pull up any kind of records that the individual might have, behavior to other people or aggressive behavior, or they might have harmed another person. And we also have this ability to contact relatives, people who have knowledge of how that individual has been acting over the last few days. It's always interesting too, because we have to try to get those family members to focus on the here and now, not 3 years ago when somebody was doing these other things, because that's not important anymore. What's important is what's happening with the person right now. So we do reach out and contact people who have been in touch with the individual to find out more, get some idea of whether they're threatening other people, threatening themselves. Are they saying things that are indicating that they might be suicidal? Is their behavior such that they have decompensated and now they're experiencing symptoms of psychosis that can be really challenging for people to have insight about? The individual you're interviewing often doesn't recognize that they are having a psychotic break. And so we have to investigate and find out more information about where that person's baseline is. And that's why we call all of the people that are involved in their lives. And we identify supports. If we need to do a safety plan, we need to know who those folks are in the community that are there for that individual, so that they can keep an eye on them and make sure that they're getting their needs met under this safety plan and make sure that anything in the home that might be that might present a danger to them, such as medications, prescription drugs, firearms, anything in the home that they could use to hurt themselves with, is removed, or they have eyes on that individual for the next 72 hours until they kind of stabilize. So we want those support systems in place too when we develop a safety plan.
Thanks for sharing that, Candy. I think it's important for people to understand it's actually required in the statutes, in the law, for the DCR to look at everything else first, least restrictive alternatives, keep the person in the community. And then the extreme last decision that's being made is an inpatient kind of a admission. How you doing, Heather?
Oh, I'm ready.
Oh, wait, you guys, there's a question in the chat box though from Phyllis Cardos. She says, are there coordinating services with Spokane for people in Ponderosa County who are in crisis situations?
Good question. So you want to handle that, Candy, or you want me to jump in?
I think I caught most of it. So are there coordinating crisis programs in Spokane? Is that what I'm hearing?
I think so. Coordinating services with Spokane for people in Ponderosa County who are in crisis situations. I think maybe that means if they're in Spokane. Not sure.
So a lot of the time what will happen is if we have a person that's from Ponderosa County that's in Spokane and that person is in crisis in Spokane, the DCR will typically contact us and let us know that one of our residents has been identified in Spokane as being in crisis, and they will tell us what institution they went to, or the crisis line will call us if somebody has contacted the crisis line that is in Spokane, but they're from Ponderosa County, and they'll alert us that the person to keep our eyes open for this individual because they could surface in our community again, and we want to be able to get them into services as quickly as possible. So there is communication with Spokane.
Okay. Thank you, Kelly. Okay, so we're going to continue on with the peer support. And next slide, please. So again, my name is Rusty Mae Squires, and I've been with the counseling services since 2007, but I've been a peer counselor since 2013. But I'm not really a counselor. So my role as a peer support specialist is to empower self-care, to build strengths and self-esteem, help bridge the gap from where they are to where they want to be. Teach mindfulness skills, breathing, relaxation techniques, help them see things differently. And as far as self-esteem, help them change the language they tell themselves or we tell ourselves. Growing up, a lot of, this is a fact that the way people talk to you, it becomes your inner voice. And so by building your self-esteem and learning where your voice is, that you have a voice, and then we also advocate for them. And I also help with individuals with anything else they need in addition to counseling that will help them reduce their anxiety and depression. And I'm going to give this to Becca, and she's going to explain her role.
Hello, everyone. My name is Becca Teeters. I am the WISE Youth Peer Partner. As I've been a peer partner for coming up on 2 years now. My role here is as a youth peer partner is to take my lived experience as a youth and turn that around for the greater good and help other youth engage in their own treatment and recovery and validate what they're wanting and what they're needing and help make sure that their recovery is individualized and driven towards their culture and beliefs, and also making sure that they're aligning with their family. Everybody has their own wants and needs, but making sure that they start working as a whole. I also empower youth to advocate for themselves, but I also advocate for them if they're struggling to find their own voice and advocating for themselves. I'm there to make sure that their voice is being heard in their treatment. I also empower them to, I empower them to find that voice though, and to give them that courage and strength to be able to take hold of their treatment and recovery. I also support them in taking their strengths and building them up, or finding strengths that they didn't even know they had. And also, I just really want them to take charge of what they have and show them that they can be the change in their own recovery and treatment, and just really empower them through and validate them, make them feel like they're being heard in their treatment and recovery.
Great, thank you, Becca. Next slide. Oh, there you are. So what makes a peer counselor? So helping people achieve their personal goals is one of life's most rewarding experiences. We show them the way to provide support, encouragement, and resource information, and we help them invest in their own well-being and recovery. They are masters of their own universe, so they know what works for them and what doesn't. We also share relevant personal experiences that foster hope, resiliency, and decrease stigmatization of mental health in illness. Having a little trouble speaking today. By sharing our own personal experiences, we share to inspire. So it gives them hope that they're not alone in what they're going through, and other people have. We share what worked for us, and we're also honest with them if something's not working, because we're all human, and we keep working those coping skills to make things better for ourselves. Next slide. Next. So what is the role of a peer counselor? So while peer counselors still have to do mandated documentation, policy procedures, ethics, we do have our own values, ethics, and practices. And how different we are from regular clinicians is we are on the same playing field as the people that we work with, because we have our lived experiences, so we can share to inspire. So we have mutual support. We support each other in recovery, sharing our stories, our fears, our hopes. We power together, not power over. It's a different kind of relationship. We recognize advocates and supports for the peer or the family as experts on themselves. And we want to connect them to their inner wisdom. And so it's not about us advising or counseling. We are suggest. We do not come into the peer relationship as an expert on life. We have empathy, and we're more respectful and non-judgmental because we've been there. So I'm an expert at not being an expert, and that takes a lot of expertise. That's hard work. Next. Oh, Heather. So peer counselor duties, and this is not all inclusive. So we assist individuals and families in developing their own goals. They know what that is, and we guide them. We share our own recovery stories that are relevant and helpful. We work at developing and supporting relationship, self-advocacy, stable housing, education, employment. I help with a lot of that as well. Job search, filling out paperwork that can be daunting, and to help reduce that anxiety. We do use specific tools and follow certain rules to help people get past obstacles and reach their goals. And one of the tools, which I think it's across the board with any counselor in this field, is we treat others with respect. We validate them, we listen to them, and that's pretty much one of the peer counselor greatest gifts is the gift of listening. Some people just need to be heard. Next. So where can peer counselors work? Peer counselors can work in agencies and organizations with training. They can do the Wellness Recovery Action Plan groups, mindfulness activities, motivational interviewing, crisis intervention. A lot of they're employed in a variety of work settings like mental health centers, hospitals, schools, community settings, crisis lines. They can be a bridge for those leaving inpatient or incarceration facilities and help transition them back to the community. So here's some great resources, and these will be on our website. So if you're interested in peer support training, you can go to that website, and there is a training that you have to do online first before you apply, and attach your certificate to the application, and then wait to be invited to the 5-day training. It's pretty empowering. So there's also a peer support email. The Wellness Recovery Action Plan, you can learn to become a facilitator, and that's a great website by Mary Ellen Copeland. The National Association of Peer Supporters, and if you type in the occupational profile on the Department Washington EDU, it gives you kind of the demographics percentages about peer counselors in our, I believe just in our state. Well, yes, just in our state. So transformation in the world happens when people are healed and start investing in other people. Oops. We missed a couple of slides.
I'm going to jump in here and just kind of do a pitch for really encouraging people to consider becoming a peer specialist, or at least go through the certification process. Counseling services, and we're not alone with this in our community, our county. There's other agencies that employ peer specialists, and certainly interested in supporting developing a workforce of peer specialists. So even if we don't have positions open, there are people who are ready to go. I mean, it looks great on the resume, and when there's an opportunity that pops up, whether it's in Pend Oreille County or across the state, you're ready to go because you went through the certification. Right now, Counseling Services does have some funds that could help support people to go through the certification. Pre-COVID, these kind of dollars were used to help pay for, a hotel or the flight or the transportation. I think right now, a lot of the trainings are actually online, but still want to really encourage that if you're interested, please consider pursuing it. We, especially in Counseling Services, would love to see LGBTQ peer specialists, youth peer specialists. There's a great need for that. And crisis services peer specialists, just the gamut of peer specialists. And again, you do not have to, I don't think the certification process is a scary process. I think Rusty can talk about how long it took for her to go through it, or Becca, but you don't even need to be a high school graduate. Really, the big part of being a peer specialist, the key element, is lived experiences. A person with lived experiences who is currently in recovery and is at a place where they want to help others. Rusty May, I think you said it was like 40 hours over a week.
A week, but Becca can talk about how long it took her to do the online one. I didn't have to do that in 2011.
Oh, okay.
I think it's about a 40-hour module. It goes a little faster than that if you just sit down and do it. And then you fill out your application, and then once you're accepted, you can go do the 5-day in-person training. They really just go in depth of what it is to be a peer partner. Also, the state offers scholarships and such to to help you get, if you don't have money and you're not with an agency, to pay for your hotel and to get you there, and pay for your food. And there's childcare funds. So they just really want you to be successful and offer you anything you can, or they can, to make you become a peer.
Thanks, Becca. So yes, the state, huge push to really develop peer specialists in Washington State. Again, a lot of resources that Rusty may put up on the website in this forum. But if you just have questions and really want to talk more about what actually that looks like, or details that maybe weren't covered today, feel free to just give Counseling Services a call, get a hold of Rusty May or Becca, and ask them, whatever questions you have about what that actually looks like, working in the field. So we really encourage, and we're just very, very hopeful we can just develop that workforce. I think it's a great opportunity. And again, you don't even need a high school degree. You need lived experiences. That's the key piece to it.
Yep, absolutely. It's very empowering training. I learned a lot and grew a lot.
And as we mentioned, you can be a peer for all walks of life. There really is, they need peers for everything.
Mm-hmm. Rusty, we do have a question in the chat box asking, what is the greatest need at Pend Oreille County Counseling Services?
specific to counseling services. That's what I'm hearing. Well, right now I'd say it's workforce. Okay. So we're at about 60, 65 capacity, and recruiting, especially the master level credential, that's a difficult recruit in the rural areas. That's historically been a difficult recruit and retention in the rural areas. So I'd say specifically counseling services, that's one. I'll probably talk a little bit later about it as it falls under the 1/10 presentation, and that is just the need for flexible funding. There's a lot of things that counseling services we do, but we're pretty much tied to the funding streams that we operate under, which is predominantly Medicaid. And so Medicaid has a lot of conditions and strings. And so there's just services that we would love to implement throughout the county, and that they just don't necessarily fall under the Medicaid scope of what's billable. Phyllis, does that answer your question or more clarity on that?
Oh, that answers my question. Thank you.
All right.
I'd like to promote that as much as I could.
Oh, thank you. Appreciate it.
Thank you, Anna. Looks like we are up for our next activity, Heather.
Yes, guys, it's time for another poll. Get your fingers ready. This one's a tough one, so hopefully you were paying attention to Rusty's awesome presentation. So this is a true false. What do you think, guys? Do 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 do. Oh, wow, you guys are fast. Look at that. Oh, 16 out of 16. And I don't know, guys. Looks like we got 100%. Sounds like you were paying attention. So the question was, in order to be a peer specialist, you need a college degree, and you 100% got that right. It is false. So like Anna said, it's about your lived experience. That is where your degree is essentially, and that's very unique to your life's path. So I think that's awesome. Back to you, Rusty.
Okay, now it's Anna on the 1/10 mental health CD tax presentation.
So I think Heather's loading up the slide deck.
You know it. Coming.
One of the things we learned from this morning session is the tech person like Heather probably could use a couple more monitors, because right now she is trying to manage what a good 15 probably different screens and PowerPoints, and doing it off of one small monitor is not easy. So good job, Heather.
I know, I was all excited about my smaller laptop. Might have should have waited to next week to get a new one, because it's minuscule.
Hey everyone, I wanted to let you know that we have somebody on YouTube who's watching right now. The name is River, and they said, I can't do the poll on YouTube. So I'm really sorry about that. That's a bummer.
Oh, can they hear the poll? They just can't answer.
Probably could see it, but couldn't do anything, is what I'm guessing.
I can respond. I can respond on my phone to them.
I'm just letting you know for next time.
Thanks, Carrie.
Can you let the YouTube folks know if they're interested in, like the random prize drawing, to still get us their name?
Absolutely.
Or contact information?
Okay, yep, I'll do that.
Okay, awesome. Thank you, Carrie. Okay, 1/10 1%. This is exciting news for the county. So since 2005, the Washington State Legislature, they passed a bill allowing the counties to impose 1/10 sales and use tax, specific to mental health and chemical dependency services and or treatment. So in Pend Oreille County, we've been having these discussions as early as 2008. Understandably, the commissioners have been fairly concerned about passing a tax in a county that's pretty limited, with resources. So that, pretty conservative platform. But in this 2019, increasing recognition that just not really getting the solutions and the relief that we need at the state and federal level, and really needed to come up with a more local solution. And the 1/10 is one of those solutions. And so I'm happy to say, as of September 21st, the commissioners did pass the 1/10. So, I mean, that's yay. Anyway, just real quick, just letting you know, specifically this tax calls out that it cannot be used for, well, it can only be used solely for the purpose of providing for new chemical dependency or substance use operations or the delivery of these services, or the treatment courts also. And it cannot supplant expenses from county general fund. So these revenues are very specific and tied to the chemical dependency mental health piece, and they cannot be somehow diverted into some other area of county needs. It also cannot supplant services already funded. So, for example, counseling services, we do crisis services, and we would not be able to use the 1/10 dollars to supplant crisis services we currently provide. Okay. Next, please. Oh, so why did we try to pursue this? Again, because the demand for behavioral health services is exceeding the current available resources. There we go. So one of the reasons why I love this community forum, I've been with the county for a good 22 years. The community forum's been here for about 14 of those years. Been hearing from folks, not just in the community forum, we had a community assessment in 2018, but throughout the years, a lot of feedback about some of the needs. And why can't we get some postpartum supports, in-home supports, pretty consistently, universal behavioral health services in the schools. Again, at least with counseling services, because we are primarily Medicaid funded, when the counselor goes into the school, they can only see the student who is under Medicaid coverage. With a universal approach, then they can open it up to all kids, regardless of what their insurance coverage is. And in some, that makes sense. There's certain things that just make sense. You just open it up because that's part of being prevention savvy and getting upstream on some of the needs here. School threat assessments, we've heard that there's a need there, and these type of assessments do not fall under our current crisis dollars. Supports to older persons, again, there's a need in this county. We have an older population, so it makes sense. How do we get these supports? And we needed that flexible funding to start really considering how to make that happen. I think most folks know we have a lot of limitations with our crisis services, that continuum of resources that are out there. So we don't have a local detox facility. We don't have a local respite facility. There's some homelessness and housing issues. Some of it's tied definitely to substance use disorder and mental health needs. We've missed some difficult to implement some innovative programs. And we've definitely missed some opportunities with grants. Okay. Also wanted to share, we've had what is the Healthy Youth Survey. This is a survey that goes across the entire county, all 3 schools with, correct me if I'm wrong, Carrie, 8th, 10th, and 12th graders. So for 2018, some of the information that was obtained from that survey showed some concerns with, I shouldn't say some, definite concerns with some increasing rates of depression. So we have a 30% with 12th graders reporting experiencing depression, 38% of 8th graders, and with 10th graders who completed the survey, 47%. Even more concerning is with the 10th graders, what was reported or shown was that 30% considered attempting suicide. Again, for the 10th graders, we had about 117 respondents. So that equates to 35 youth were considering suicide. And of that number, 15 students reported that they did try to kill themselves. An active suicide act is what they disclosed. And again, I just want to emphasize, these are just the students who completed the survey. So that was very, very concerning. I think that's one of the reasons why the 1/10 was passed, is just a strong recognition that there is a need. We've got to figure out how to get ahead. And a big part of that is needing some flexible funding to move around some barriers. Again, some of those barriers, for example, counseling services does receive federal and state dollars, but there's a lot of restrictions tied to it that hamper how we can draw down those dollars. Another thing is, we're trying to figure out how to do some bi-directional work, and Medicare is definitely an area that there's a lot of interest, how we can get some more supports, behavioral health supports in that area. But Medicare rates are very, very low. So it's a challenge to find providers who are able to provide services at these low rates. Also, Medicare has some billing restrictions that are very much tied to credentialing requirements, and these limit the scope of practice. So for example, Medicare will recognize a licensed clinical social worker, emphasizing license. So you can't just be a social worker, you have to be licensed, or higher level credentials. So that usually means you have to be a physician assistant, a clinical psychologist, psychiatrist. These are very, very challenging credentials to recruit and retain in the rural areas. So with flexible funding, it gives us an option to look at other ways to develop programs that can maybe work around, the Medicare limitations. Next slide, please. Thank you. So we had to do initial focus because these dollars are pretty limited. Again, it's based on sales and use tax. I think to date, for up until August, I want to say, if we had it implemented, it would have been about $80,000. We looked at how much would it have been over the course of time from 2012 to 2019, I want to say, and the average was between 122 to about 150,000. So we are not talking about a lot of money on the table. And so we knew that we needed to really narrow that focus, at least initially, to meet the actual intent here. Thank you, Heather. And so one area that we thought we could probably take a pretty good bite out of was the intersection of criminal justice and behavioral health. And this is based on some studies. Go ahead. Okay, so we have some studies. There's quite a bit of information out here, but these are the bites that really kind of interested me, I should say. So one study showed that 83 to 89% of people with mental illness in jails and prisons do not receive care. We can say that is happening at the local level too, even though there's definitely expressed interest in need. So our criminal justice partners have definitely over the years been saying, hey, how do we get some more support for our residents who have these behavioral health needs? Also, another study showed that the first week of following release from jail or prison, a person is 12.5 times at risk of death and are more likely to come into contact with emergency room services. Next one, Heather. Okay. Also, while a person, not everybody knows this, but while a person is incarcerated, Medicaid is suspended. So you could even be enrolled in counseling services. You can actually be one of our clients. If you become incarcerated, we're not able to actually go in and do counseling, individual counseling or group counseling at that point, because there's no longer a paying source for it. Also with local past efforts, I can't remember how long ago it was. I'm going to say probably a good 8 years or so ago. We did actually used to go into the jail and do some cognitive behavioral therapy, some group counseling. And at that time, the residents there did give us some feedback. So it's anecdotal, but it was enough to inform us that, hey, there's an interest here. And we're being told that it seems to help. Unfortunately, then we also received feedback during an audit that that's not a billable effort, and we really can't do that anymore. So we had to pull it. And again, if we have to pull services that are not Medicaid covered, because that's our primary funding streams right now, And if we engage in services where we can't attach it to a revenue source or funding stream, then it could look like Medicaid fraud. Okay. Another reason for the 1/10 why I thought it would be a great time to do this was to enhance capacity with local efforts already started. So Newport Hospital and Health Services, they actually have a provider that goes into the jail and is managing the medications for the residents. There's been a request, and it makes sense. How come we don't have counseling happening at the same time? And again, that makes sense. Evidence-based practices says that, you know, best success, best outcomes is you combine counseling along with medication. Next one. Thank you, Heather. And then lastly, you know, timing wise, there was an opportunity to leverage dollars quickly. Better Health Together as a grant. It's a $500,000 to the rural areas, the rural partners. And one of the provisions in this grant is that you have to demonstrate that the grant dollars would not be the only source of financing for the project. So again, 1/10 dollars would serve as a match for this grant. Okay. What we're hoping, if we are awarded this grant, then we'd be able to put into the jail, you know, different diversion options, actually some screening and resuming some of the counseling services. Probably just as important is that some of that transitional case management support, not only while a person is incarcerated, but also post-release. Next. Okay, so what does this cost the taxpayer? Again, this is a sales and use tax on non-essential goods. It's not a property tax. So an example is that food is considered an essential good and so would not be taxed unless it falls under prepared foods. And so what are prepared foods? This is generally defined as heated foods, combined foods, or something sold with utensils. Also businesses where 75% of their business total is in food sales, they are required to charge sales tax. So these would be, you know, the restaurants, the taverns, coffee shops. That one hurts, the coffee shops, and or cafes. Okay. Thank you, Heather. And then there's an assumption that you know, a portion of this is going to be borne by people passing through the county, and we do get some tourism that comes through the county. So a lot of folks are going camping on their way to Priest Rivers, on their way to Canada. They're stopping and they're shopping, and they would be supporting the county with their dollars. And just FYI, when you go into Spokane and you're purchasing things, especially non-essential goods, then you are contributing to the Spokane mental health and chemical dependency programs. Next one, please. Thank you. Oh, okay. So I'm a visual person. This is the reason why this is on here. 1/10, what does this mean? 1/10 amounts to 1 penny on each $10 purchase of non-essential goods. Or if you were to buy $100 worth of camping gear, that would equate to a dime on that $100. Okay. There's a return on investment also. There's evidence out there that demonstrates that for every dollar invested, there is going to be a return. Basically, treatment not only saves lives, but it also saves dollars. And I think we're at the end there. So thank you. Any questions?
We have a comment. Someone says that they're shocked that Medicaid is suspended for those in jail and prescription drugs can be administered, but not counseling services. So it was alarming to me too when I first heard that.
And that's a recent change. I want to say, was it last year, the state, or it could have been the year before, but very recent. It used to be completely, it was terminated. And so there's been a lot of advocacy to at least make it, move it to suspended versus terminated. At least when it's in a suspended state, when a person is released, they can easily resume getting back on Medicaid without having going through a pretty arduous kind of process to get re-enrolled. But yeah, it's at some point, I think there's still a lot of advocacy to make those changes where Medicaid covers that too. I know there's a lot of interest, that intersection with behavioral health and mental health and substance use disorder, a lot of recognition that really needs to happen in our jails and our prisons. But it's just a slow moving machine. I think at some point we'll get there. But yeah, when I first heard about it too, I was surprised also. It didn't make sense at the time. Still doesn't make sense though.
Okay, thank you, Anna.
Actually, we have another question.
Okay.
This one comes from YouTube. How does Ponderay County Counseling Services support minorities and LGBTQIA+ populations in a rural community, especially during these times?
And I missed the A+. I think I heard something about A+, but what I can say is, I'm wearing my pin. Where is it? I know that we are very strongly interested in diversity, exclusion, and inclusion. There's quite a bit of work going on right now with Better Health Together, so quite a bit of training. One of our platforms is LGBTQ, and like I said, we would love to get some peer specialists who are LGBTQ. We certainly provide services, counseling services. I hope that we have a very welcoming atmosphere. We have, staff help me out here with when it comes to, we've got stickers. We want to make it very clear, this is a safe place. Come be with us, and you should be able to come here and not worry about a lot of those things that are just pretty pressing in the outside world kind of thing. Anita?
Want to add on to what you were saying, and so in the month of June we flew the LGBTQ flag. That was all really important to us so that we could show the community members that that we are inclusive and supportive to the LGBTQIA community. And our agency has provided trainings to all of our staff so that they are up to date on information about supporting LGBTQIA community members. And I know that it's in the works that we are going to have continued training so that we can be understanding all the new information coming and just always be up to date so that we can support you. And the same goes for training for diverse populations, not just LGBTQIA, but as far as minority groups. We get trainings on those, and you didn't speak to that, Annabelle, so maybe you have more information that you can provide.
On the trainings?
Well, she had asked how we support minority groups and LGBTQIA groups, and I kind of spoke to the LGBTQ, but I didn't know if you had more information about how we are supportive for minority groups as well.
Right now, it's a lot of training, and I know we have a lot of great ideas. COVID has kind of stalled out some of these. I'm just going to keep saying great ideas. So despite COVID, we're going to just keep pressing forward, but it has slowed down some of the partnering we want to do. Youth Emergency Services, they're really taking a lead on a lot of the work. The Ponderay County Health Coalition, we have an equity initiative that's going on right now. And so what I'm hoping is, as we kind of get back into stable post-COVID or new normal, however way you want to look at it, we're going to be able to pick up the banner again and just keep moving forward with what we hope is going to be, really robust diversity and equity and inclusion. Pretty open. I know we're trying to have those conversations in-house, having some activities in-house just to really keep us very aware. The little, not so little actually, things like having pronouns, practicing that, just to send the message out that this is an inclusive place.
And I just wanted to add also that we developed a diversity statement. Is that what you would call it, our diversity values? It's something that we're very focused on and making sure that we are being inclusive. We're doing evaluations of our forms to make sure that no matter what background you come from, that you feel included, that you don't feel like you have to check a box that doesn't necessarily fulfill your identity. So these are areas that we're very much passionate about and making sure that we're coming up to speed. Being that this is a community forum, we would welcome your feedback and we always do. If there's an area where you feel like you would like to give us feedback, we always want to hear it because our goal is to serve you all. So whether that's in the chat box, through email, calling our number and asking to speak to somebody, we're always open to hearing how your experience was and how we can do better.
And thanks for bringing that up, Heather, because some of the changes that we've made have definitely been directly from feedback.
Okay, thank you, everyone. So shall we get started on the next presentation for self-care during COVID?
Real quickly, there was feedback and they said, glad to hear this community is working towards inclusion across the board. So yes, thank you, that's awesome.
Thanks, Carrie. Alrighty, I'm getting you going there. Hold on. I have so many PowerPoint slides up. It's like, I don't even know which one to pick. Okay.
Pick mine, pick mine.
While you're putting that up, Heather, the other thing that just came to mind, the Camas Center, we're very, very fortunate. We have the Camas Center 20 minutes from us. We try to have very strong partnering and just that consultation piece. I know that for the most part, if somebody comes in and they're from the tribe and they're seeking services, if we do a crisis evaluation, then unless the person is telling us we can't do it because we do have to honor confidentiality still, then one of the things we automatically do is we're going to make contact with the Kalispel tribe and get a consultation and try to make sure that we're doing the coordination piece together.
Yeah, good point, Annabelle. And I'll also just add to that, we do have, what's your specialty called, Annabelle? We have a few of them, but we have specialists in our building that specialize in, is it ethnic minority specialist?
I am an ethnic minority mental health specialist. I could do Teresa, it on, right? Is Teresa? Yeah, and Teresa's probably leans more towards the Spanish. I was trained in the Native American, and then I also have a background because I'm biracial as an Asian.
Awesome. Cool. Well, we're ready if you're ready, Rusty. I'm ready. Get you going there. You see it?
I see it. Thank you.
Cool.
Okay, so this is I'm gonna do a presentation on oops, I lost.
This happens every time I try to mute myself. They just don't want me to mute. Can you see it now?
I can now.
Okay.
So I'm doing a self-care during COVID-19, and that will include mindfulness practices to reduce anxiety and stress, self-care for parents during COVID, and some good resources. Next. So how can you take care of yourself during COVID? This is a very stressful time. It's unprecedented. It's normal that your loved ones might feel anxious, sad, scared, or angry. You're not alone. It's okay to seek out and ask for help. Next. So media has been focusing on the outside shield to minimize the spread, like physical distancing, washing your hands, wearing disposable masks and gloves, sanitize, and washing your groceries. But there's a second important overlooked line of defense, and that's the inner shield. It's vital to take care of our immune system during this time, but our emotional well-being has been put at stake, so it's vital to take care of ourselves as a whole. And part of that is what we eat, what to eliminate, move and be mindful, mindfulness, ways to connect the body and brain, and sleep like your life depends on it. And that's not always easy for a lot of people, myself included. So what we eat and what we choose to eliminate from our diets. Food choices also impact anxiety and stress, which can impair the inner shield and mental health. Move and be mindful. Your immune system needs you in order to be activated. So any exercise you do, and this also includes housework, I was so happy to hear, can strengthen your immune system as well as decreased episodes of illness and reduce inflammation. So moving and being mindful can have a huge positive effect on your mental health as well. So our minds often the mind and body are so disconnected that even while you're exercising in the here and now, your mind can be 1,000 miles away or in the past. So mindfulness benefits, including health, including the function of the immune system, being in the present moment allows us to slow down and concentrate on what is important in this new normal that has been thrust upon us. Next. Connecting the body and the brain, doing mindfulness exercise, meditation, like taking a walk, taking a bath, going for a walk barefoot on rocks or grass, or do yoga. It's vital, not only for the brain and body, but for your emotional well-being. You become more grounded so you can think clearly about what your next step is. So sleeping like your life depends on it. This is when your body does its best work. It's another vital part of your self-care. So many things can come into play that disrupts our sleep: anxiety, pain, physical and emotional, illness, busy schedules. So during this pandemic, we've all been forced to change and reevaluate the way we do things, to see things differently. Our lives have been disrupted, and familiar structure and routines have changed, often resulting in feeling lots of stress. So sleep is a vital thing we have to do. What you do during your day can affect how you're going to sleep at night. Practice letting go of your day. Write down your troubles that you had during the daytime and give yourself permission to deal with them tomorrow so you can sleep and let go of your wakefulness. It's also important that not only what you're doing during your day, but right before you go to sleep. So self-care for parents during COVID. The one positive thing I can say about this pandemic is it has made us reevaluate what is really important in our family life and our work life. It's created a lot of stress, economic stress, schools closed stress, limited time stress, losing our job stress, being quarantined stress. So this is where self-care comes in. We need to adapt to this new normal as much as we don't want to. So keep familiar routines. Think about the things you don't have to change, like your morning routine or your evening routine. Implement family meetings, and effective communication is very important. So check in with each other. Maintain good boundaries, as change often brings resistance from others. And patience is more important now than ever, and everyone can learn patience. So you create a schedule and post it and get all family members involved. Children and teens are most likely to follow the schedule if they are part of the process. And also include exercise, outside time, screen time, other activities like being silly together, dancing together, singing together. It's bonding time. And this is also a great time to teach kids new things. They love to learn. And so teaching them skills like cooking, cleaning, working in the garden, just anything they can do. It's just another skill they can add to their resume of life. Parent self, or next slide. Oh, oh, sorry, I went ahead of myself. There we go. Parent self-care, make time for yourself. It's okay to practice forgiveness and self-compassion. You got to be realistic about setting your goals. There's no playbook for this now, so now's the time you can create what works for you and your family. Remember, you are doing your best during this very difficult time, and you are enough. So self-care is more important now than ever. Even now, busy schedules can be a difficult time to find that time for yourself. Both men and women, and yes, even men, need to implement time for themselves. A lot of people say, I just don't have time. It does take determination and commitment, and to take care of you. If you are a two-parent household, check in with each other on important needs for the day. Keep that communication open. Parent self-care. You can look at your situation and see what you can do to spare at least 5 minutes of quiet time for yourself. And being a single parent, it might be more difficult to find that time. But be thoughtful and intentional about how you're treating yourself and your body. You can be intentional about creating space to recharge and decompress. This could be taking a shower, walking outside in nature, taking time to read, just sitting and being without thinking about things you got to do. Relax. We have to take notice of our environment, and perhaps the most challenging, caring for yourself. So by participating in your life instead of retreating, you can help reduce one of the greatest insults to any infection and life-altering event, fear. That usually paralyzes people in a heartbeat. So good resources are American Academy of Child and Adolescent Psychiatry, the National Federation of Families for Children's Mental Health, Washington Listens, the coronavirus.wa.gov is good information to keep you updated on this nasty virus. Big Life Journal is a great opportunity you can get freebies on creating activities with your children, and they can learn new skills. And how to support each other during COVID, to go optionb.org. And this is a new book by Sheryl Sandberg and Anna McGran about facing adversity and building resilience and finding joy. So take care of yourself because you're worth it. Anybody has any questions about that?
Rusty May, can I speak to Washington Listens again?
Yes, please.
Okay, I just really want to emphasize that that's a resource that the state rolled out specific to COVID. And so you don't have to be a resident of Pend Oreille County. It is available across the state. It's really kind of geared towards that supportive listening and connecting to resources. And again, so this is a good example, or at least I think it's a good example. You might be a person that does not want to enroll in counseling services, but you are having some stress from COVID or need some resources. It might be happening at 12 o'clock at midnight. It might not be a crisis, but you still need some help. My understanding is Washington Listens is a great resource that you can give them a call and just be able to talk to someone and just kind of help find some support that might be very, very specific to COVID. It might not be specific to COVID, but it'll give you that extra support if you don't want to be in formal counseling services. It could also be supplemental. You can be in counseling services and use Washington Listens also.
Thank you, Anna. This resource page is also going to be on our website as well. And I think the Washington Listens is also on there too. Okay, so next we have Anita. She's going to talk to us about her being a school counselor.
Hi, my name is Anita Waterman. I'm the school-based counselor, and I go to all the schools in our county, including Selkirk, Cusick, and Newport. There it goes. And when I have clients that attend these schools, my clients have the choice of either meeting at the school or in my office, and we also have an office at the Cutter Theater in Medellin Falls. When I go to the school, they provide me with a private space for our counseling session, and depending on the client's age and their attention span, I usually meet with them anywhere between 20 to 40 minutes. Can you go back to the last one? So if you're interested in getting in services, you can contact the agency, our agency directly, or you can speak with your school counselor. So the names on the screen would be the points of contacts for each school. And but if you live in Pend Oreille County and you don't attend any of these schools, maybe you're homeschooled or you attend a school out of the county or a private school, you can just contact the agency directly. And then we offer the same services in office. So in Washington State, youth that are 13 years or older can enter in mental health services without permission from their parents. So students that are interested in getting in services that are 12 years and younger will need permission from their parents and as well as parent involvement to be in services. At this time, Newport School District has gone back to digital learning with the exception of students with an IEP, and Cusick is all digital right now, and Selkirk is doing in person, but tomorrow they will be deciding whether or not they are going to continue with in-person learning or move to digital. And all of these will be depending on COVID cases. So within a few weeks, we could be continuing doing digital or being in person. So for me, it's equally important to provide services to all the schools in our county. And however, at this time, I don't have enough clients to drive to Ione and Medellin, but I have been coordinating with the Selkirk school counselor, and she sets me up, sets my client up with a tablet and puts them in a private room so that I can still meet with students that are attending the Selkirk school district, even though I'm not able to see them in person. So right now, with most of the schools closed and our agency doing telehealth, it can be really difficult for kids to be in services. Most kids struggle to talk on the phone or do Zoom meetings, especially when they're already doing Zoom for their classes. So for me, it's my goal to do my best to accommodate these students that aren't able to meet on the phone or over telehealth. So if you are interested in getting in services, or if you already have a youth in services, please let me know as far as school-based counseling so that we can accommodate that. And that's all I have. I just wanted to introduce myself and open it for any questions about school-based counseling.
Thank you, Anita. Carrie, we have anything over YouTube? Any questions?
No, not at this time.
Okay. Okay, so next is Heather, and she's going to talk about My Strength.
Awesome. Thanks, Rusty. Get up my PowerPoint now. All right. Let me know when you can see it.
Now.
Awesome. So My Strength is a service that we purchased about a year ago, and we couldn't have been more timely, not knowing that COVID was going to hit. We were already prepared, which is amazing. But really, My Strength is a service that we were interested in because we felt like it augmented the services that we were already providing. So it's not in place of counseling, but it's a great way to extend counseling services, especially as people progress in their recovery and they might be discharging, and now they have a tool they can take with them. Once you're signed up for My Strength, you will forever have My Strength. So this is something, it's our gift to you essentially. And while it used to be only for our clients, during this COVID time, we have opened it up for our community because we feel that strongly that it's such a great resource that people can access. Like Annabelle was talking about, not everyone wants to come into counseling, and that's okay. It's not even a great fit for everybody, but this service provides support for mental health and behavioral health in general. So you'll see everything from physical health to mental health and substance use disorders. So the way I kind of think about it is like a kind of a social media for wellness, in the sense that there's constant content that you can access at your fingertips. So you can use it on your phone, you can use it on your computer, your tablet. There's a variety of content. So you might want to do like an activity on that has videos. You might want to just scroll through some motivational quotes. So there's journal activities. There's just a ton of variety, and I think there's something for everybody. What I love about My Strength is that it's personalized. There's 13 different evidence-based programs that they focus on. So that, like I said, it's everything from stress to chronic pain to more serious issues like bipolar disorder and, psychosis. That's a new module that they just added. So it's really kind of runs the gamut. I also appreciate that they provide mindfulness activities, including spiritual content, if that is something that you're interested in. Like I said, it's evidence-based, which I think is the biggest key, because I don't know about you, but sometimes I find quotes on Facebook that maybe didn't actually go back to the source. So what's nice about My Strength is that it's actually curated by evidence-based models. So these are all books that you might have seen. They're workbooks that have been research-based. So what evidence-based means is that these interventions have been tested on certain diagnoses, and to show its effectiveness, that you can recover using these models. And so that's why we don't like to label people. Treatment diagnosis can be really helpful because it kind of narrows the scope of where we can start looking for resources. So how does MyStrength help? Well, like I just mentioned, it's evidence-based. So you know that the material that you're reading or the videos you're watching, they're intentional. They were created for whatever diagnosis you might have or whatever issue you might be facing. The things that you identify that you want to work on, the material is specifically designed for that. Like I mentioned earlier, it's also holistic. We're looking at the mind, body, and soul. So there's mind activities, there's things that have to do with your body. So stuff like sleep, you can track your nutrition, chronic pain, whatnot. And then that holistic part of spirituality, if that's something that you want to incorporate, they have all different types of faith-based modules as well. Demonstrated results. So the great part is that this is all data driven. And so we can see it's anonymous, so we don't actually see who's participating, but when you put in your demographic information, it goes into, like a portal where they're looking to see, as Annabelle mentioned earlier, in our county, we have an enormous amount of youth who are experiencing depression. And so when we look at our results and the people who have signed up, we can actually see that they are getting better by the data that is being given to MyStrength. So everything is confidential, but as you sign in, as you log in and share your information with the platform, we can actually see that as you continue to participate, you're getting quicker, faster, which I think is wonderful. Again, like I mentioned in the last few slides, it's personalized, it's relevant, everything is up to date. So like I said, MyStrength puts out new material all the time. When we first signed up a year ago, they wasn't at half, but maybe was like 9 or 10 modules. They're now up to 13, already putting out 14 and 15. So constantly adding material, which I think is wonderful. And then you can personalize it to what you want to work on. And it doesn't have to just be one thing. If today you're interested in working on sleep, but then tomorrow you realize, you know what, I'm feeling a little down, I want to do a module on depression, that's okay too. It's at your fingertips 24/7. So once you log in and you have an account, you can go on anytime. You can do it in the middle of the night. You can do it as you're waiting at the doctor's office. You can do it, in your car, not driving, but whenever, wherever. Like I mentioned earlier, it's completely confidential. So we just give you the login information. Counseling Services has paid for a license that we can give out codes for people to sign up. So there's no cost to the consumer. It's absolutely free. Like I said, it's our gift to you. And then once you sign up, all your information is completely between you and MyStrength. And so if you forgot your password or anything like that, you would contact MyStrength. And then, like I said, your information is not shared with anybody. So when we talk about demonstrated results or data, they're just looking at demographics. So female, male, age range, those types of things. Hopeful and helpful is why does it help? Well, because it's a tool, right? And it's something that you can use anytime. I don't know anyone who doesn't have some sort of device. I think we're all kind of techie at some level. So I think we are all on our phones, so why not? And then also maybe it's something that can keep you motivated to continue to want to work on your recovery. And then finally, it's web responsive, it's mobile. Like I said, it's a tool for your toolbox, use it anytime. So I mentioned that it's customizable, so you can use it however you want to, and that you put in your own data, right? Every day you're or however often you sign in, and I'll show you in a little bit what that looks like, you can track your information. And so again, just like that data is being rendered on an aggregate level or larger level, you can see as well if some months are better than others. I'm sure all of us would kind of have probably a slump during COVID. I don't know about you, but it's been tough. But you can actually see your results, which I think is also really powerful. I think what makes behavioral health different than other illnesses, so for example, diabetes, you get blood tests and it tells you how you're doing with your blood sugars. Everything about behavioral health is typically just observable data. So you can say, I kind of feel good today. Well, what is that? Is there a number to that? You can assign a number to that, but it's still pretty objective. And so at least as you're assigning your own data, you can actually see where the trends are, which I think is pretty cool. down here, I don't know that we have coaching, but you definitely can go into the community and I'll show you what that looks like. And then there's a ton of different programs and in the moment tools. So I'm going to go ahead and give you guys a little example of what that looks like. I'm logged in already, but can you see it is the question?
No.
Okay. Can you see it now?
No. Now we can.
Oh, okay. So remember I showed you those graphs. So this is where it's getting that information. So this is completely optional. You do not have to track this if you don't want to. You can still use MyStrength. But I just find it really helpful because I don't know about you, but sometimes I forget when I was having a bad day, or like I forget when I was feeling really great, or and so this is something I can reflect back on, and it's pretty simple. Some of us like to journal and write, lots of paragraphs about how we're feeling, and this kind of makes it easy. Are you doing great? Are you doing not so great? So today I'm feeling pretty good. I've had a really great day, got to spend time with my coworkers and do the community forum. Pretty fun. So I'm gonna go ahead and give that high points. My energy had probably a little bit too much caffeine, so I'll go with high on there as well. Exercise, not so great. I've been sitting all day, so that's, I get a bad point for that. Pain, I'm feeling pretty good as well. So I like that I can put my feet up here. Sleep, how are you feeling? I don't know. Didn't sleep that well. I do have an almost 2-year-old who keeps me up a lot, so that wasn't great. And stress, I'm middle of the road. You can also write a little note here if you want to. Remember, this information is completely confidential. So you can write whatever you want, but if you write something that includes like something that's really serious, like something that you might hurt yourself or hurt somebody else, nobody's monitoring this because it's confidential. So just be aware of that. This is only information for yourself. So I want to remember that I had a great day because I love the community forum. I'm going to look back on this in a few years and I'm like, yeah, that was really fun when we did it virtual. Or I'll look back and say, can you even believe it? We ever did it in person? Hopefully not, but it logged me out. Okay, hold on. Hold please. I'm just going to stop sharing so you guys can ask me questions while I re-log in because I got kicked out. You guys have any questions? Is anyone familiar with this platform? Is this something you would utilize?
Heather, just to clarify, there was a question. So this can be used on a smartphone or computer, either or, right?
Yep.
Awesome.
Either one.
Okay.
It might be an issue with the server because the VPN. Okay, I'm good. We're back. I just got kicked off by the VPN.
And then do you see that in the chat? We have a question. How do people sign up for an account? What an awesome program. Yeah,
I'm going to show you guys the code. So like I said, MyStrength is something that only you can get from a provider. So that might be your mental health provider, your physical health provider. And so in order to activate an account, you have to have a code, and I will go ahead and give that at the end of the demonstration. And like I said, typically in the past, we've only given this to our clients, but we feel so strongly about this resource, we wanted to share it with our entire community. So anybody can be a part of our MyStrength. So one of the things that I really wanted to highlight, because many of you who have come into services might be aware of resources, for depression and anxiety and things like that. But like Rusty May mentioned, like these are unprecedented times. Like who has the roadmap of how to survive during COVID? And I like that Rusty May touched on, it's not just our physical bodies. Of course, we're washing our hands, we're wearing our masks, but like, how do we take care of our mental health during this time? Nobody knows. Well, MyStrength has specific resources for COVID, which I think is so cool. So I don't know about you, if you couldn't already tell, I'm a total extrovert. I love people. I want to be around people. I can't be around people because I have to social distance, and that makes me sad. So I can now do a module about how to increase my feelings of connectedness during COVID. I totally need this. This is going to get me through the days when I just wish I was sitting in my office, hanging out, eating candy bars with my coworkers during my break, of course, is what I mean. So loneliness and COVID, I can read all about this. I can go through, there's 7 different steps. I have people coming in the room. And, I just love that it's totally in the moment and it gives me relevant information. I can review this as many times as I want to. I can stop. If that's enough information, I'm done. If I want to start collecting more information about, okay, this is making me think now, okay, what do I want to do? How are some ways I can stay connected? I love that it's giving me options. I can start writing a plan for myself. So listing people that I can connect with. It's putting me into action right here. How am I going to do that? So again, it could be as involved or as little involved. If you don't want to do this part, you don't have to. If it was enough just to know that you're not the only one who's feeling lonely right now, that might have been enough for you. Or maybe you need to start coming up with a plan. So again, this is just looking at one module about COVID, but I hope you can see how wonderful it is to kind of get your brain moving. And if you don't have someone to talk to, you kind of feel like you have resources at your fingertips. I mentioned the inspiration page before, and I just want to highlight this before I pass it over. But I don't know about you, but I'm super meme crazy. I love memes, especially funny ones and cute ones like this. I mean, if you're having a hard day, like, do you not feel awesome now? Like the baby beagle is telling you you are. So it must be true. But just kind of going through these things. I love this. It puts life into perspective. Life is like a camera. Focus on what's important, capture the good times, develop from the negatives. If things don't work out, take another shot. So again, everything from evidence-based practices to just motivational quotes that you can maybe hold on to during the day that'll kind of motivate you to move forward. So that's a quick and dirty overview of my strength, but someone wanted to know the community code, so I want to go ahead and provide that for you. 1 second while I pull that up. Any other questions in the meantime while I get that up? No?
Okay. I don't see any. No.
Okay, so here's the code. Oh, go ahead.
Sorry, I think you said this, but just in case, once you have an account, it's forever. I mean, unless my strength goes down, it's a forever resource.
Absolutely, which was another huge decision making for us, because the generosity is insane. I mean, to be able to provide this no matter what, there's no strings attached. This is absolutely for you. This company truly believes in providing tools and resources for people. And I love that it's in today's age, because if you have been to counseling before, you know that your therapist is going to give you homework to take home or assign you a video or give you this book. And I don't know about you, but it ends up in the back of my car and my kids end up stepping on it or like dropping ketchup on it. And then I forget and I get in trouble because I didn't do my homework. So now it's like, I don't have to worry about that. Some of the things we've been doing at counseling services with our clients is orienting them during our appointments. So we kind of get you on there, show you how it's working. It's pretty intuitive. I don't know if you guys had questions about how to navigate it, but as you sign on, you're going to get some good information about what to do next. So I do want to show you guys the login code. Where did it go?
We do have a question from Phyllis.
Yeah.
She asks, can we share the code with others?
Absolutely. Yes, please do. That was one of the things when I spoke at the Health Coalition. Annabelle wanted us to share it with the entire community, which I think is very, very generous. So here we go. It's working now. Yes. So this is one of the flyers that we had sent out, but it kind of walks you through how to do it. But really, you're just going to go to mystrength.com. Oh, okay. You're going to go to mystrength.com. It's going to ask you for the access code, and here it is right here. POCCS community, all one word. POCCS is uppercase and then community. And then once you put in that finish up your access or your demographics, so it's going to ask your email address, probably your age. Not everything is required. Most of it is optional, but remember that this really helps us, or not us, but My Strength, to know what's working. So as you're putting in your information and they're tracking it from an anonymous level, they can see, oh, this is a really popular module for kids. This works for kids. And then they can give us the feedbacks as providers. Hey, if you're looking for resources for this particular community or this particular population, this seems to be really popular and useful. So, but again, share what you feel comfortable sharing. Feel free to reach out to us if you have more questions. In the future, we're going to be putting up some info sessions, some tutorials on how to access MyStrength if you have questions about that. But I would just encourage everybody, as we do with our staff, just to jump on and kind of explore it a little bit and see what works for you, because it is that personalized tool. So you're going to figure out what works best. So that's it for me.
Question.
Yes.
So we've got a question wondering if the access code is listed on our website, because they want to share it with their friends, the service that we offer. Pass it along.
Have it on our website. We'll probably get back to folks only because the website is open to the world, and that's not a problem. But we do want to keep it within our county as much as possible, just because we want to make sure that we are a resource. Again, remember, this is not to replace counseling. It's not to replace medication. It is to augment counseling, or for those that maybe don't meet criteria for counseling, but really are just looking for some extra support, especially during this time. So we'll think about that and get back. But they can always call our office. We have tons of flyers. I'm happy to send those out. We have cards, posters, all the things. So.
Okay, so yeah, maybe we could like mail some little cards off.
Oh, absolutely.
Who wants
yes.
to hand them out? Yeah.
Yes, for sure. And I love that people want to share it as a resource, because it's definitely a word of mouth type of thing, because if you've used it and you enjoy it, like you said, Carla, it's, other people want to do it too. So.
Awesome.
Cool. Thank you, Carrie.
Thank you, Heather. So now we can open this up for discussion within the community members. If you have any other questions about anything that was presented today, you may speak. We want to hear your voice.
This includes any kind of feedback about needs, not just feedback about counseling services, but needs in the community. Again, like I said, when we did the 1/10th, a lot of the information over the years came from community forum. See some things in the chats, I think.
Mm-hmm.
Oh, great. Thank you. I'm glad to hear that this has been a good information. Yes, Sophia, we'll get you presentations.
And we have our YouTube viewer letting us know that they will be contacting our office to get the flyers to hand out.
Wonderful.
To their
Wonderful.
friends. Yeah.
Thank you.
And actually, anyone who wants a copy of the slide decks, we probably won't put it on our website, but we'll certainly more than happy to share it. Just call us or email us and we'll send it out that way. And then just a reminder, let us know if you want to be part of the random drawing. Give us your contact information.
Oh yeah, let me put in, feel free to email Rusty.
Yeah, I'm putting that in there now.
Okay, thanks, Rusty. You're way quicker than me.
I have another note from our viewer. Hold on, let me make sure I can see it. It says, I think I just want to reiterate the need for diversity, inclusion, and a sense of belonging, especially to such a small and conservative area, which, yes, I agree 100% with that.
Absolutely.
Thank you for this presentation. So glad to have made it tonight. Thank you. Thank you, River, for joining us. Let me mute myself.
And again, with the diversity, equity, and inclusion, if there are very specific ideas, please just throw them at us. We don't pretend to know all the ways that we can make this happen, make it be awesome. So we really rely on our community members to just give us that feedback. Thank you, Bethany.
Thank you, Anita. So while people are still wanting to ask, Heather, did you want to do the third poll?
Absolutely. So our last and final poll, last time to get another entry to win a cool prize. We'd like to know, in your opinion, what are the most pressing behavioral health needs in our county? And again, Zoom is pretty specific of how they allow us to collect polls. So of course, this is not all inclusive. This is kind of the things that we talked about today. But if we're missing something, feel free to put it in the chat box. Here's the poll.
We do have another question from Phyllis. I can imagine all of you are overworked. How can we help?
I appreciate that. I'm sure everybody in the forum here is going to very much appreciate that. Just even asking that question helps. Otherwise, just a kind of a shout out and together fighting stigma. That's a huge, huge thing.
Yes, absolutely.
Right, it looks like the majority of folks have shared. So we have 90% chose all of the above. We have some people saying depression and substance use. So definitely, I think we have a lot of areas of need in our county. And I would just encourage you, if something here wasn't addressed, please email Rusty May, write a comment on our YouTube page. We also have a Facebook page we'd love you to visit as well. And we're just here to listen.
So if there aren't any more questions or comments, we can kind of get ready for our closing. I do want to make a shout out and kudos and a huge thank you to Shane from our ID department for all the hard work he did helping Heather get this Zoom platform created. Very much appreciated. So I want to thank all of you again for joining us for our 14th annual First Community Zoom Community Forum. So we can only hope and pray that we go back to in-person forums for 2021. So thank you again for being here with us today and giving us your input.
Thanks, everyone.
Thanks.
Thank you.
I have something real quick. So our YouTube viewer says all of the above, definitely, because they can't see the poll. So I put a question in there. So they were right with the all of the above or the presentation.
Yes, I agree. Nice one, River. Right on point.
Thank you, everyone.
Thank you.
Thanks, guys.
Bye.